Hello, everyone, and what the hell is going on with our hospital systems? Are they going to fail? What does that even mean? How is it going to affect our medication supply? All of these different things, which is a really scary question right now. And this is Ask Me, I'm a Scientist. My name is Susanna Harris. I basically just bring on experts because I have a lot of questions. I know you have a lot of questions. And whether it's these topics that are really difficult and really scary, especially in the time of COVID-19, or it's just general exciting science, I think it's so important to talk to the doctors, the scientists, the researchers themselves. Real quick before we launch into everything, please remember to like and subscribe. That helps me keep going with these videos. And you can always follow me if you have other questions after the video or if you want to make sure to catch everything. So, extremely excited today and very thankful to our guest for he's so busy right now and just doing such important work. So we have Dr. Pranishs Kantesaria, and he is working down in Austin, Texas, and he's the director of pharmacy at the Baylor Scott and White Institute for Rehabilitation. And we're just going to be able to ask him a bunch of questions about hospital systems, about what is happening with our healthcare right now. So, Dr. Kantesaria, it's so great to have you. How are you doing today?
I'm doing good. It's as you can imagine, a little busy, but we're doing okay. We're still in the early stages here in Texas,
Yeah.
so it's kind of the calm before the storm.
Yeah, something we haven't talked about actually is that my younger brother is he and his girlfriend live down in Austin, Texas, and it's yeah, it seems like it's hitting there a little bit slower than some cities, but it actually sounds like Austin has been more proactive than a lot of the other cities.
Austin has been very proactive,
That's great.
um, probably the most proactive in the state,
Yeah.
um, and I think a lot of it was because this happened right when South by Southwest was going to start,
Mm-hmm. Mm-hmm.
and so they had to kind of make very early how seriously are we going to take this? And they decided to take it seriously.
Mm-hmm. Yeah, I think that really set the tone. I was scheduled to go to a bunch of different meetings and give talks, and those were canceled, and a lot of that happened right after South by Southwest. And I think, as questionable, I think in the description I put lackluster as our healthcare response has been. I think there's been some shining examples. So, would you give yourself a little bit more of an introduction? Mine was super bare bones, and you have such relevant experience for all of this. So, kind of, what were you doing before this, and what is your role right now?
So I'm by training a pharmacist, and I have worked in hospitals my entire career, um, mostly in a management role. So, being a director of pharmacy at pediatrics hospitals, community hospitals. I've worked at level 3, level 1 centers, academic medical centers. And part of what I've always done and part of what you do with pharmacy is supplies and logistics and planning. And one of the things that I was involved in back in 2007 was planning for the pandemic bird flu
Ooh,
response,
yeah,
our bird flu that never came.
yeah, yeah.
And so a lot of those plans are, now getting dusted off.
Yeah, I think, it seemed like the general response for a very long time, especially from our current government system here in the U.S., was that this isn't going to touch us. So,
Yeah, I was reading an article today, and I believe the term shambolic parade of incompetence was used. So,
oh,
yeah.
wordsmiths. That is about perfect. But I want to launch in these questions because I've got a few people have been asking in Instagram. The moment I put up that we were going to talk about this, it's very apparent how necessary these conversations are. There's so many questions around it. So we're just going to start with a really basic one. Just, how do hospitals work? You kind of talked about that, the supply chain from the pharmacy side. Uh, I actually, when this question came in, I didn't have any idea how a hospital system worked. I know that I go in and I get treated and I come back as a healthier person.
So most hospitals are not for profit. Um, but they're all run obviously as businesses, right? Um, One of the things that people don't necessarily realize is we have a very low number of hospital beds per 1,000 people in population. We're at 2.8. We're a little bit higher here in Texas. We're at 2.9 per 1,000. For reference, Italy has 3.2, and South Korea has 12.3 beds per 1,000 people in the population.
Okay. All right. All right. Ooh.
So one of the things that, is going to be a problem is obviously space and just actual beds. And the thing to remember is those beds are an average of all of the different types of beds. Med surge, post-op, the types of ICU beds that we're going to need a lot of are within that number. So there's even less of those.
Interesting. Yeah, that's something I really haven't thought about at all. And I know, or at least maybe you could explain better than I can to our viewers, but it seems like one of the biggest reasons that we're being asked to do the social distancing is not so much, young, healthy people are especially susceptible. It's quite the opposite, that it's much older populations compared to something like the flu. But what I've understood from it is it really is about these hospital systems, about what happens.
Yeah, so flatten the curve, right?
Yeah. And
that's the phrase probably everyone's heard.
Yeah, but could you explain it a little bit? I think that it's unfortunately become kind of the 2020 catchphrase.
So I think the thing to realize is we don't know how much of the population is going to be infected, right? Because we don't know what the prevalence is right now. And so based on whatever infection rate you choose, 20%, 40%, 60%. Mark Lipsitch at Harvard is an epidemiologist who modeled it at those three different places, infection rates. And the way that the time frame in which they get sick is really important. So if 20% of the population is going to get sick anyways, if they all get sick at once, then you're going to need all those beds all at once.
Yeah.
Whereas if you spread it out, you're going to be able to discharge people. Some of them are going to pass away. Some of them are going to get less sick and move to less acute units. And then you have room to put another person in that bed. So the more we spread it out, the more our hospitals are going to be able to accommodate this. And remember, babies are still getting born. People are still having strokes. People are still getting cancer. People are still getting in car accidents. So some of the things that these ICU beds are needed for are not going to stop.
Yeah, I had to go to Lowe's I had a bunch of light bulbs go out, and I went at 9 o'clock on a Tuesday, and it was completely deserted. And I sort of was looking around and thought, hey, I have some house projects I could work on. And then I realized, I can't risk getting hurt right now. I'm not personally very afraid of getting this virus. I'm pretty resilient towards a lot of these things. Of course, that I don't want to. It sounds awful, but it for me directly, it is much more about what if anything else should happen. And actually, one of the questions that we got in Instagram, and this is why I tell people to go ahead and subscribe and go to Instagram as well, is that people ask me these questions. And so one of the questions that Nikita Sloan asked was, how will this affect others who need urgent and critical care, such as cancer patients? Obviously, there's going to be a strain on the system, but is this going to, do you have any idea, and this is one of the questions I've really had, of, is there going to be partitioning of patients? Is it going to be a first come, first serve like it normally is?
There is going to be partitioning. So there are hospital systems in Austin, and I know that they're doing this in Seattle and in New York as well, where they have so-called clean hospitals and then contaminated hospitals. So, if you have cancer and you need surgery to remove a tumor or whatever,
Mm-hmm.
you're going to go to the clean hospital,
Mm-hmm.
um, which is where they're not treating active COVID-19 cases.
Okay.
And then if you have COVID-19, then you're going to those contaminated hospitals to get treatment.
Yeah. Yeah. I think actually UNC just started doing that. It said something about tents and little pop-up
Yep.
things, basically to keep people out of the emergency rooms.
Yeah.
So
And I
yeah.
think it's important. I think it's important to also understand that most hospital units are staffed for 70 to 80% of capacity.
Interesting.
And so when, a hospital goes to full census, when it's 100% full,
Mm-hmm.
they rely on what we call PRN staff.
Mm-hmm.
So part-time contract workers who come in, usually have other jobs and they're picking up extra shifts as a second job,
Okay.
kind of thing.
So are there
I
going
don't
to be
know
enough
how
of
much
those?
resilience. What?
Are there going to be enough of these PRNs?
Oh God, no.
Okay.
And I think that's going to be the limiting factor. Is it's not going to be the beds. Well, it is going to be the beds, but if you can't have a nurse staff the bed, then the bed is useless.
Sure. Sure. Yeah. I mean,
And
if we're
so
go ahead.
our biggest bottleneck is going to be healthcare workers.
Okay. Oof. Oof.
And a lot of them are going to get sick.
Uh-huh.
A lot of them have been exposed and are still working because there's no one to cover for them. And a lot more are going to get sick because they don't have supplies. I don't know if you read this morning, CDC has approved scarves and bandanas as face masks for healthcare workers in hospitals
Mm-hmm.
in case they don't have the proper protective equipment.
Yeah. Yeah. There's been so many. I don't know what the right word is for this, but so many things highlighted that have just been pretty horrific in terms of how underprepared we are and how this kind of fear mentality
Well,
has changed everything.
I think it's important to understand that our our healthcare system,
Mm-hmm.
people say it's the best in the world, and I think that it is in terms of excellence and the ceiling that healthcare can reach in the US versus a lot of the rest of the world. But our floor is much lower
Mm,
than many other places in the world.
okay.
And so the system was built so that people that are insured and people that can afford it go to hospitals.
Mm-hmm.
And that's not everybody. That's not a lot of people.
Mm,
Um, and so when you build a hospital based on how many patients you're getting, and you're only getting the ones that can afford it,
mm-hmm.
then you're not taking into account the whole population.
Right.
And so we've been shedding hospital beds in this country for decades.
Hmm.
My wife works at a level one trauma center downtown, and they just built a new hospital and moved in 2 years ago.
Mm-hmm.
So it's, brand spanking new.
Mm-hmm.
Nice glass and steel and very fancy sculptures, nice upholstery on the chair still and all that stuff.
Yeah.
Um, when they moved from the old hospital to the new one, they actually decreased the number of beds.
Mm-hmm.
And that's not an outlier. That's pretty common.
Hmm. Wow. I mean, I just never knew any of this. And so God, there's so many questions. I guess one of the questions in is all of our. I know that the U.S. compared to so many other countries has done a terrible job of testing in terms of percentages of people. Um, why is that happening? Is that just because there's a shortage of people? Is this a capacity issue? What's going on?
Um, well, part of it is our healthcare system is very heavily regulated, and I'm probably going to get in trouble for saying this, but it's very much like a cartel in that once you are part of that system, it's very difficult for other people to come in as new players into the system. There's a lot of regulatory barriers, there's a lot of financial barriers. There was a scientist who was doing a flu study in Seattle, and I think her name was Helen Chu, and she figured out a way to test for coronavirus and actually picked up one of the first community transmission cases. And even after that was shown to be effective, the FDA shut her down because it was against regulation. And so there have been a lot of hoops to jump through to even get the capacity up and running. And then it didn't help that the first batch of test kits that came out were contaminated.
And wasn't it, I mean, there was something too about that there was a kit that was approved outside of the US for a long time that we didn't start using for quite a while.
Yes. And in a lot of places, we still haven't started using.
Wow.
Yeah, and a lot of this is because there hasn't been a very coherent national response. A lot of governors and a lot of states are doing it themselves. And every state has different regulations. So, for instance, any medical professional, if I moved from Texas to Minnesota, I would have to get relicensed. And so, and one of the things that I would have to do is I'd have to take a law exam because the laws that govern pharmacy are different in Minnesota than they are in Texas. And they're different in almost every state. Almost every state runs its own healthcare. So in terms of getting the test approved, that's a federal job, that's the FDA. But in terms of actually implementing them, that's a state thing.
So, and we're talking here about just the testing themselves, right? Because of course there need to be really rigorous testing for treatments, and that needs to be peer reviewed and all the different phases of clinical trials. But this is talking about testing effective ways to just even spot the virus. This isn't something that's going to be directly affecting the health. You're not going to be giving someone a virus, or you're not going to be hurting their immune system by testing this. And so that's why, as a microbiologist, I was sort of shocked at how few tests have been done.
I think one of the things that has hurt healthcare is you're familiar with the book Anti-Fragile?
Yes. Yeah. Great book.
Right. So, you want to be resilient and robust. The healthcare system is very brittle.
Right.
Up until recently, I kept maybe 3 days worth of drugs on my shelf. Because you don't want to carry too much inventory, because then that's a cost issue, right?
Yep.
And you want to run as lean as possible. And we've done this with all these supplies. So once the tests were available, there weren't enough RNA extraction kits so that you could prepare samples for the test.
Right.
Now we've run out of nose swabs.
Wow.
So, it's not just the test, it's all of the stuff that's surrounded by the test that, if you've only got a 2-day supply, you can test for 2 days, and then I guess you go to CVS and buy Q-tips. I don't know.
Yeah.
What you do.
It's just so much uncertainty right now. I do want to talk, especially with your background as a pharmacist, and you've worked in so many different settings. I want to talk about how this will affect our supply chain. We're talking about we're running out of RNA test kits. We're running out of basic stuff like masks and gloves and nose swabs. I'm somebody who takes. I take antidepressants, anti-anxiety medication, and it's something that I've been concerned about, just on something that's totally, I feel, unrelated. But the question of if that's going to be stocked, but also the medication that people specifically need to combat this virus and to get healthy.
Yeah, so I think what most people don't realize is while a lot of are medications. So like the actual pills you take are made in the US.
Okay.
The active ingredient, the actual chemical that does the work, most of them are made in India and China.
Oh, yes, I did not know that.
And so most of our medical supply chain, a lot of parts for our ventilators, hydraulics for our hospital beds, most of that stuff is made in China because almost everything is made in China. It's the world's factory. And so they shut down, that affects not just iPhones and things like that, but it affects heparin and anticoagulants and antibiotics and antidepressants and, pretty much everything.
Right.
We've also, I've seen on Twitter and in the media, people are calling it the Chinese virus. Don't piss off the people who make our medicines, please.
Yeah, and just don't be an
Because
asshole.
regardless of what you think, if they're in control of our supply chain, let's be nice to them.
Yeah. I mean, I think so much of it is just stuff that people don't know, which is why I just so appreciate, because you're juggling about 15 different things right now, and so I so appreciate you doing this. One of the questions too that I wanted to bring up is like other national stockpiles. I've got somebody in the question. Oh man. Salt Sandor, I hope I got that close, talking about, backup stocks of ventilators. Are these numbers that we're seeing there, or even, the stuff that we use in the ventilators, things like oxygen? If we don't have like very basic things stocked, do we have enough of this other stuff?
So we have caches of drugs and equipment stationed around the U.S., and we call them the SNS, the Strategic National Stockpile. And they get deployed wherever there's a hurricane or, anthrax outbreak, or if there was a chemical weapons attack or whatever. And they do have IV fluids, they do have oxygen, they do have PPEs, which is masks and gowns, and they do have ventilators, but they have about, I've heard anywhere from 12 to 14,000 ventilators. And I think we're going to need somewhere on the order of 100,000 more. So they've only got about 10% of the ventilators. And ventilators are one of those things where you can't just, oh, I'm a tech startup, I'm going to 3D print a ventilator and bring it to market, because it's going to take you 24 months with the FDA to do all the testing and get all the approvals. And so in terms of really ramping up our capacity, it's not going to be fast.
Right. I mean, gosh, there's so many questions coming in, which is great. So let's see. Yeah, I mean, we've got a question from Elizabeth Dellery. Are we working towards getting more supplies for hospital staff in the U.S.? Is this something we're trying to ramp up, or is this a process that is not something that you can turn around in 2 months?
So we are working on it. There have been some strategic national stockpile caches that have been released to hospitals that have been hard hit. A lot of hospitals, again, because there's no national plan around any of this stuff, are scrambling with their vendors to buy them like they would normally buy things in a normal time. And there's just not enough out there. That's why their CDC is letting nurses use bandanas. I still can't get over that. China is slowly getting up and running, and so that will help. But really, it's going to get worse before it gets better. And the problem with that is our healthcare workers are very, very much in the sweet spot of the vulnerable population. So the average age of a nurse is somewhere in the early 50s in the U.S.
Wow. I had no idea.
And so, you're talking about, 20-year-olds aren't going to get this, and if they do, it's going to be mild symptoms. Well, there are going to be a lot of nurses that are going to be out of action.
Yeah. Yeah. I mean, we've got a question. This was a really interesting one. It's a question I've had as well. Uh, on Instagram. Y1 Garashi, there we go, said, I would love to see a mobile infectious disease unit. Thoughts? I've seen some like tents going up. Different places have been going house to house. Are we going to see more mobilization of this care, or is that totally out of our capacity?
Right now, that is totally out of our capacity. In terms of mobile infectious disease, you have to balance that sweet spot of if I'm going from neighborhood to neighborhood, am I spreading the disease or am I preventing it by keeping people in their homes?
Mm-hmm.
If you don't, hose down with bleach the entire mobile unit, are you really being safe? Can we do that?
Mm-hmm.
Um, and so I think in terms of with something like a hurricane or an earthquake, a mobile healthcare mobilization or units make a lot of sense. If you can't get out and you need chemotherapy, I can come there in a Winnebago and make chemo for you,
Mm-hmm.
that kind of thing.
Mm-hmm.
With infectious disease, it's not like we're going to be able to come to your house and set up a ventilator.
Right. Right. So even if
Right.
we could do
So,
testing, it's what are you going to do?
exactly.
Mm-hmm. Mm-hmm. What do you think? What are the long-lasting implications of this? You said it's going to get worse before it gets better, and I mean, I know the administration. I just don't have words. I think the words that you quoted earlier is about as good as we can get, and I try not to use like f words on this show, so I think I'm fairly limited. But for a long time, it was sort of a ignore it, don't worry about it. And then a few days ago, we heard, this is not going to be at all figured out until July, August. One, what is long term? What does that mean? And then, what's the long term for healthcare in terms of like the summer versus is this going to affect how we deal with things in a couple years?
Well, I think my answer is that depends.
Okay.
And I know that's a very weak answer,
Hmm.
but
It's an
I
honest
think one of
answer.
the things that I think one of the things that's going to become very apparent in the next 3 to 6 months is as a country, how do we feel about a lot of people dying? We okay with it? And we're pull ourselves up by our bootstraps, everybody for themselves, or is it never are we going to let this happen again? And that's going to dictate a lot of the direction that our response takes.
Mm-hmm.
Are we going to build excess capacity? Are we going to have extra personnel trained? Are we going to have a plan put in place before any of this happens to make sure that it doesn't happen again?
Mm-hmm.
Or are we just going to get through it and then we go back to life as normal? And then when the next one hits us, and there will be a next one,
Mm-hmm.
um, we'll figure it all out from scratch again.
Yeah. I've got an interesting question here in the chat, wondering how the private healthcare insurance sector might fare with this. If we dry up financial reserves, are we going to see healthcare institutions asking for bailouts? That might be like
Oh,
way
yeah.
over. Okay.
No. Absolutely. We will. I think we already have.
Okay.
I think there are already hospital systems that are telling that they're going to lose money because you're not going to let someone die in the street.
Yeah.
And so, what are you going to do? You're going to treat all of the people that need treatment.
Mm-hmm.
And if that's an expensive ICU bed, and ICU beds are tens of thousands of dollars a day
Mm-hmm.
in total cost right now. Um, who's going to pay for that?
Yeah.
Especially if they're uninsured or lots of people on the insurance have lifetime caps
Mm-hmm.
and a huge deductible that they might not be able to afford. And I think you'll see medical bankruptcies going way up.
Okay.
It's already the biggest area or the biggest kind of personal bankruptcy in the U.S. And I think you're going to see that just exponentially grow.
Mm-hmm.
I think you're going to see hospitals that are providing free testing, buying the supplies and not getting reimbursed for it. They're going to need a bailout. The insurance companies, I don't know about that, like the private insurers, how they're going to be able to handle it, because I don't know things like how much cash reserve they have and what deals they've worked out with the government and that kind of stuff. But definitely, like hospitals and manufacturers and things like that will definitely need bailouts.
This is just, I mean, it's so complicated. Um, I have two more questions for you. One is, what are you interested in seeing? You're obviously so well versed on what's happening in the news, and you're clearly doing your own Googling and using your expertise. What are the things that you're looking out for right now, or you're trying to inform yourself on?
So the one thing that I'm looking out for is how quickly we're ramping up our testing capacity,
Mm-hmm.
because that's going to give us a better idea of what the infection rate is and what the mortality rate is going to be.
Okay.
And from there, we can start planning a lot of different things.
Mm-hmm.
So you can start planning about how long social distancing is going to need, because then you can model when the infection will peter out.
Mm-hmm.
You can decide whether or not it's going to be endemic, and then we have to come up with long-term plans. What are we going to do about pharmaceutical supply chains? What are we going to do about healthcare personnel? Are they going to be working 12-hour shifts? Are they going to be, working every day? What do they do when they have kids that are out of school? Who's going to take care of them? I know a lot of hospitals, my CEO is looking for a place to set up impromptu daycare in case we have to bring our kids to work.
Yeah.
Which, bringing my kid into a coronavirus central is not my idea of good parenting, but sometimes you got to do what you got to do because we took an oath, right? And we got to take care of the people that need taking care of.
Well, I mean, thank you so much for what you do. I just, like we chatted about before this call, there is no way that I could do your job, and we need a lot of people like you. We need more people. We literally need more people.
We need a lot more.
Yeah. Um, since this has been sort of a heavy episode, and it's just, I mean, I've learned so much. I've got so many things to look up. I'm going to be adding some links down below, and I encourage other people to keep asking questions, either in the comments or over on social media. I'm going to ask you kind of a weird question. Do you see any silver linings at all with this? It's a horrific situation. We don't know what's happening. Um, how are you keeping your spirits up? How are you staying motivated through all of this?
Um, Family helps, having a good social support and emotional support, but really, I think the silver lining for this is we're going to see as a country how prepared we want to be for the next one.
Okay. Yeah.
Are we going to have national health care? Are we going to make sure that everyone who needs treatment can get treatment?
Mm-hmm.
What are acceptable losses? I mean, I saw a senator that said, oh, if a couple million people die, that's not a big deal. Still 97% of America will be fine. If that's the kind of country we are, then I don't see a lot of silver linings. But if we're deciding we're better than that, then, preparing for making sure this never happens again, I think is the silver lining. I think we're getting taught a lesson, and it's up to us how much we learn from that.
Yeah. It just sounds like, we have the opportunities to make our own silver linings, but it's going to take a lot of effort and just
It is.
concerted
I'm reading a good
sacrifice.
book on plagues right now, on something like this.
Yeah.
It's called The Plague by Albert Camus.
Oh, that sounds really exciting.
Yes. It's actually really good. And I'm going to finish up this with a quote from that,
Yeah.
if you don't mind.
Yeah, please.
One of the heroes in the book says this towards the end. And it may seem a ridiculous idea, but the only way to fight the plague is decency. And I think that's what we're going to learn about ourselves through all of this. Are we going to be decent? Are we going to leave enough toilet paper for the next person?
Mm-hmm.
Are we going to help out our neighbors? Are we going to do the things we need to do to make sure we learn from this? Or are we just going to go back to business as usual after this is done?
Yeah. Well, Pranish, you're doing amazing things, and please take care of yourself. With you and your wife in the healthcare industry, I mean, your family is already giving so much, and for have you to come on here and help educate us, hopefully help speak to an audience who has a lot of questions and has a lot of fears. This has just been amazing. We've got your Twitter handle underneath there. Are you comfortable with people reaching out to you and asking these sort of questions?
Absolutely. If you want to shoot me questions, go for it.
Okay. Okay. Well, thank you again so much. Please take care. I would love to talk to you again in the future because there's so many questions and it's just, you're so knowledgeable. This has been, I've only done a handful of these so far, but this has been one where it's just extremely eye-opening, and I really thank you for it.
You're welcome. I had a good time with it.
All right. I will talk to you soon. Okay, everyone, that is the end of this Ask Me I'm a Scientist. Take care of yourself. I think that one was a tough discussion. I think these are the discussions we need to have. But like Pranish said, it's focusing on family, it's focusing on social connections, and it's focusing on decency. We heard from Kenan a few episodes ago of his sort of hope with this is that unlike a lot of other natural disasters, there are ways that you can take control and that you can behave in a way that you're going to be proud of in the future. So it's a scary time. We're all afraid. We're all uncertain. And hopefully this is helpful. If there's other people I should be talking to, other people who are going to help kind of get through this haze of questions, let me know. Send them over to me. Easiest to reach me through social media, Instagram, Twitter. And go ahead and like and subscribe to this video. Again, everything's turbulent. I love doing these videos, trying to figure out the rest of my life. And this just lets me know if it's worth it to you to keep going. So until the next episode, please take care. And yeah, I will see you soon. All right.